Okay, 6:07, let's get started. Okay, the camera is on, let's wave to the camera, okay?
What is it?
It's right there.
Oh, there.
Okay. I call the meeting to order. Roll call, please.
Dr. Joel Bourne,
Present.
Stephen H. Gill,
Present.
Dr. Pimentel,
Present.
Okay, we have a quorum. I call the meeting to order. This is Tuesday, September 9th, 2025, and we're in the City Hall, room 202, second floor, DPW conference room tonight because of early voting. So, are there any discussion or corrections on the minutes that we have a copy of from our meeting on July 8th? If not, can I have a motion on the floor to accept the minutes?
Can I have the,
I make a motion.
I make a motion to accept the minutes of July 8th, 2025.
Do I have a second? All in favor? Aye, okay, then we'll accept these minutes. I'll sign where I need to sign. Okay. Very good. All right, I'm gonna pass those back to you. Okay, I'd like to just start with a little public health update. We are still in Massachusetts in the midst of a summer COVID surge. We're at the tail end of this COVID surge. The current variants are the Stratus and the Nimbus. The Nimbus and the Stratus. And so in this past week, there have been 1,100 cases documented. I'm sure many more because people don't test. And there have been 132 hospitalizations for COVID in the state of Massachusetts this week. I know that I had personal experience with the summer surge because my entire family got COVID, and my wife, who never gets sick, was quite ill. So we encourage our citizens, our public. The current vaccines are active against the new strains of COVID-19. I know there's been a lot of questions regarding the Health and Human Services at the federal level, restricting vaccines to individuals greater than 65, but in the state of Massachusetts, we are all protected, and anybody can get a COVID vaccine over the age of 6 months. We continue as a board to encourage both children and pregnant women, people at high risk, people over the age of 65. Anybody that wants to get a COVID vaccine should be able to get a COVID vaccine at their pharmacy with no doctor's order at no charge. And that is the current policy of the Healy administration. So we encourage the citizens of Lawrence to reach out to their pharmacies, their primary care doctors, to get their COVID booster coming and the best time to get it is really the month of October. So we're shooting to get it, the majority of people to get it in October to protect them for the worst months ahead. That is my public health update. We'd like to jump to the tobacco product sales update with Caesar.
Yeah, this will be quick, I don't have a lot. Before I went on vacation, this board had decided, I believe it was on June 10th, to suspend the tobacco permit issued to Hammel's Liquors at 678 Cable Street for 7 days to begin on the 23rd of June and end on the 29th. So that suspension was carried out. It was carried out without any incidents. Another thing that I have is that we're looking to contract a contractor to help with the tobacco inspections and education in the city of Lawrence. This will be a Spanish-speaking person, like a native Spanish speaker. I think it will help him with any possible language barrier that might exist when I try to use my Spanish. So we should have that person aboard within the next month or so.
Great.
And then we are just beginning our inspections for the fiscal year, and we're going to resume compliance checks pretty soon as well.
Okay, thank you for the update.
Mhm.
Okay, we're gonna move to new business. Given that Pamela is out, I know Esmelda you're covering, so of these 5 cases, which are we gonna address first, you suggest?
606.
Yes,
Canal
it's
Street.
Okay, let's talk about 606 Canal Street, Inspectional Services, case 22-010924.
606 Canal Street, we have, we received our engineering report for the tight tank, from the, the owner hired an engineer to do the inspection on it, so the engineer, is present with us today, Alec. He has a report that he submitted, it's in your package, regarding the tight tech and some variances request. He's here present, and he can speak on.
He's out, you're out?
Yeah.
Okay, great, Alec, let's hear from you.
Hello, my name's Alec Chongers with Chongers Engineering. I'll give you a quick background. So I originally got reached out by Edwin and also your consultant at the time, I forget his name.
Ethan.
So I'm going over about this property on Canal Street. From my understanding, based on talking with Orlando and him, was that there was a tight tank installed at a certain date, but there was no variances or no approvals, permits ever issued for the tight tank itself. So what we agreed upon was me to do a little investigation. I've reviewed the Title V report, I did a site walk, and I wanted to see what variance we required from Title V in order to get the, what variances would have been required for the tank to actually get put in the beginning. So I can kind of go through all sorts of, I'm not sure how familiar you guys are with Title V, I'm assuming not too familiar since there's not much septic in this city.
I don't mean to interrupt you, we talking about the Lawton's property? This
Yes.
is six?
Yeah.
606,
Yeah.
the former
They have
Lawton
a
property.
preliminary, license to operate
Yeah.
pending the results of the type check.
Yeah, absolutely. So Title V inspection was performed. It was by Stewart's. It was passed. It was very well known. They work a lot within the Merrimack, Essex County area. So how I can go about it is if there's quite a few variances we kind of have to go through. Would you like me to read them kind of one by one and what the requests are and why we have to request them? Is that the best
I
approach?
think that would be helpful,
Yeah.
if the board
Yeah.
agrees.
Alright, so I guess again, these are coming straight out of 310 CMR Title V. That's what dictates septics. And I'll give a quick background too. You're able to, when you're dealing with an upgrade, and under kind of upgrade standards, it's pretty much tight tank is the worst case scenario because you always have to have something to function in if you're unable to feasibly connect to sewer. So how that works is it's not new construction. If it was new construction, you wouldn't be able to do it. But since it's existing, you're able to request all sorts of local upgrade approvals and variances. I'm gonna go through there's local upgrade approvals, which I'm requesting, then there's also variances. A local upgrade approval is kind of how the state created Title V a while back, where like the health department can just grant certain variances that they call local upgrade approvals without having to go to the state to get approval. And then there was certain variances that you had to go to the DEP to get approval. Since then, DEP pretty much got rid of, they don't wanna see anything come to the desk, so everything gets approved by the health department now. But I'll start with the local upgrade approvals that are required. So, a local upgrade approval is requested in accordance with 15405-1A to allow a tight tank to be placed less than 10 feet from a property line. So as you can tell, but this site is extremely small. I'd be surprised if the total width was more than 15 feet of the property, so you're unable to make that setback. So we're requesting a variance to allow variance needs to be requested to allow the tight tank to be within 10 feet of the property. The next variance requested is from 15405-1B to allow a system component to be placed within 10 feet of the foundation. This is kind of similar to that one. There is no way we can avoid having it. The property is too small and we need to have it right next to the foundation just because we can't maximize that 10-foot setback. Another local upgrade approval requested is to allow a tight tank to be within 25 to 50 feet within a BBW or within a resource area. As you know, you're right on the canal. It's in a resource district, so we unfortunately aren't able to request it further away because the entire property itself is within a resource area, so that local upgrade approval is required. Now on to the variances. There's a whole sort, in order to, a tight tank, as I said before, is the last resort in terms of, for Board of Health Title V, because they want you to have some sort of system if you can't connect to sewer or you can't have a septic. So how the health departments allow you to have a tight tank, you have to meet certain criteria, which I'm gonna go through now. So 15268-2A, the tight tank shall be sized at a minimum of 500% of the system sewage design flow, but no case be less than 2,000 gallons. So this is the big one that needs to be requested. So right now the existing tank is only a 1,000 gallon tank, and so we need to request a variance to allow it to only have a 1,000 gallon tank rather than a 2,000 gallon tank. The design, there is no established design flow, so when you don't have the design flow on record, you kind of backtrack to see what the design flow should be. And the design flow that the design flow that I came up with is about 200 gallons per day. So 2 times 5 is gonna give us that 500% increase, so in that sense, we do meet the requirement to be 500% greater than the design flow. However, we can't meet that 2,000 gallon requirement strictly to site limitations. So variance is requested to allow you guys to give us approval for the 1,000 gallon tank.
It just doesn't fit.
It doesn't fit. It's, if you go on the site right now as it is, the tank is essentially, excuse me, is essentially fully exposed and hanging out on a cliff, so.
Yes.
And you can't really expand it further, without kind of going off your property. Oops, next one. If I have any questions, feel free to stop me. So plans for the tank shall be prepared, stamped and signed by a Massachusetts professional engineer. The system has already been installed, so we're requesting variances to allow, we're requesting a variance not to have a design plan submitted since the system's already installed and it's, kind of counterintuitive, and that's why we're requesting that variance. 15260 we need to have visual audio alarms, so with a tight tank, obviously the effluent can't escape anywhere, it needs to be pumped, so the state requires you to have alarms at 3/5 the level full. The Title V inspection report says 2/3. I'm assuming that's just an inspector doing it, so I'm sure we can confirm it's set at 3/5, but that we do meet that requirement. We'll confirm we meet that requirement, or just adjust the floats if we need to. The application for approval shall indicate the method and frequency of approval of contents. Based on the size of the building, it's about 429 square feet. We assume it's about a 200 gallon per day flow, so it's most likely gonna need to be pumped 1 to 2 weeks, depending how frequently it's used and or whenever the alarm goes off. And the applicant is aware of that. The next one, the application for approval shall indicate the method and frequency and removal of the contents. It's very similar, so this will be removed by a licensed septic removal company, and they will comply with all state regulations as they need to have their septic hauler license. The next one is the tight tank shall have at least 1 24-inch diameter cast iron frame at finished grade constructed so to eliminate the entrance of surface waters. Permanent suction piping may also be required. So the current system right now does have a plastic cover, so that will need to be replaced with a steel cover to be compliant, unless you guys wanted to issue the variance, but since it's in a very accessible place, I'd recommend having the steel cast iron frame, and that can be constructed. The next one, the tight tank shall be located to provide year-round access for pumping. It's very visible, the thing's probably 70% exposed, so that's not an issue. A permit to install the tank shall be obtained from the approving authority. We're applying after the fact. An O&M plan needs to be provided to the approving authority. This has been provided to the approving authority, and it's just essentially getting pumped every 1 to 2 weeks or when the 3/5 level alarm goes off. The tight tank shall be waterproof and watertight. The tight tank that was shown is a shea concrete tank. That's a very standard run-of-the-mill tank. Those are typically always watertight, and if it wasn't watertight, you would see effluent leaking out of the tank itself. There is no uplift force that we need to design for, just because the system is essentially above grade, so there's no groundwater that's gonna push it up. Aeration or other method of odor control may be required. I'm not anticipating that this will be required. If there hasn't been an issue yet, if that does come, then there can be mitigation to try to prevent that, but I don't expect that will be needed for this particular property. And last but not least, the tight tank shall be designed in compliance with the requirements for the construction of septic tanks 310-15-226. This was purchased by Shea Concrete, who follows state regulations, so that is also met. I know I get a lot, and I didn't know how else to really go about it, because this is a funky lot, but if you have any questions, I'd be happy to take anything.
Any questions?
How much more would it be steel cap versus plastic cap?
Hey, what do you mean, how much the construction cost? I can't say it'd be too high construction cost, it's, you can probably be fine, it hasn't been an issue now, it is a requirement, just, it's more or less for safety, for people don't go in there. It does have a loft, but I assume it's probably I wouldn't anticipate any more than $1,000, but I don't quote suffer construction.
Any further discussion? Okay, so these variances that are requested, do we make a motion to?
You would make a motion,
Grant
correct.
each one individually, we have to go down the list.
Yeah, sometimes with a bunch, they just kind of sum it up,
Okay.
but.
Would you like to make a motion?
I didn't bring my glasses, so
Okay,
Dr. Vidal shall be the reader today.
so I think you should just, I think given the historical relevance of this property, the geographical constriction of this property, the fact that it is not near a sewer line in the city of Lawrence, The fact that Shea Construction followed all the regulations in terms of the construction of the tank, I think that this board, should grant a variance for everything that we discussed. Number one, the tight tank, could not meet the 10-foot setback, and we're gonna grant a variance for that. That the entire site is within the watershed of the Merrimack Valley Canal, but in order for this tank to be used and this property to be commercially viable, we have to, I believe, grant a variance for that. The
red ones.
Okay, so let's stick to the red ones. I make a motion to,
I make a motion to, due to the size of the container and varying from 15 to 60.28, it's required to allow it to be used a 1,000-gallon tank.
excellent. Let's start with that one. Do I have a second on that motion?
second.
All in favor?
Aye.
Aye, so that motion carries. Let's move to number 2.
So I make a motion for the tank that has already been installed by others, having earlier date on the plan that were never submitted, a variance from 15.2602B is requested.
Do I have a second on that motion? All in favor?
Aye.
The motion carries, that motion is granted. Let's go to number 6.
The motion to the current system has a plastic cover. This needs to be replaced for the cause iron frame and cover.
Do I have a second on that
Second.
motion? All in favor?
Aye.
That motion carries as well. So that, is that so?
Yeah, so I guess to be clear to you guys, I could have worded that better. Do you want us, you do want us to replace the frame?
Yeah, I think.
Yeah, definitely.
Understood. Cast iron, I think that would
Yep.
be good due diligence.
And those would be all the ones that need to be
Great.
requested.
No, thank you for bringing, that's a great education about Title V for us. There's very few septics in the city of Lawrence.
Absolutely, I knew it was the hot dog place, that's why I took it.
Yeah, no, I mean, I have my,
Oh, no problem.
my.
I also wanna add something.
Yeah.
The owner, Oppenheimer, he also had requested in the past with the board, to turn on water service. Since then, it hasn't been turned on currently due to this, contingent
Okay,
engineer.
we can make a motion
Yeah, make a motion to
turn on the municipal
service.
water.
Yeah.
Can I have a motion?
Second motion?
No, make the-
I'd like to make a motion to turn on the municipal water for 606 Canal Street.
Second motion?
Yeah.
All in favor?
Aye.
Okay, so great. You're good to go, man.
Buena
It's been a
suerte.
long journey.
Voy para allá, no está.
It's been a long journey.
Thank you.
Appreciate the city
alarmers, I appreciate the inspectors.
Okay,
Thank you.
Yeah,
When can I call to make that,
right away.
right away. But well, call tomorrow.
I'll call after
Yeah,
12.
close
Yeah.
today, so.
Thank you guys, thank you to City Alarmers, I
And
appreciate
follow up with me.
I
and
look
we'll-
forward to growing with you guys.
Yeah.
Thank you.
All right, thank
I
you.
would like to move to a very critical issue regarding a fire incident at Winfield Alloys. What inspector is gonna present this in?
Before that, can it be possible we leave that for the end?
Sure, that's not a problem. Which one do we wanna take next?
We have the medical waste management department.
Okay,
We have, the representative here.
okay, hey,
Hello.
welcome.
Thank you for having me, appreciate it. So this is the first time I've done this, so I guess I'll introduce kind of what I'm proposing and look for feedback from you guys.
You got it.
So we have created, I own an electronic recycling company in southern New Hampshire. Through this process of about 4 years now, hospitals, pharmaceutical and med device companies have contacted us on a more sustainable approach to recycling medical waste. So the best way to think of it is they're looking for us to kind of recover the plastics, any metals, which will be minimal, and repurpose those devices. We have no location yet, but we're looking at doing it in the Merrimack Valley area. So I've reached out to the Department of Health for the state and qualified some of the equipment that we need to do it safely and effectively, and really kind of seeking more guidance from the city of Lawrence if this type of procedure is allowed. I can walk you through kind of our policy and procedures on how we would do it, but the most simplistic way to think of it, is we'll collect sharps containers, so to speak. Comes to the facility, we manage reverse logistics, it gets thrown into an autoclave type machine combined with a shredder. And then it gets, all the materials and commodities would get separated, and we would repurpose the repurposable devices, mainly plastics, some metals. The other stuff that, due to regulations and compliance, that would have to go to incineration, would go to incineration. We are not intending to do that for waste to energy, but that would be our preferred method, and that would probably go to Covanta, Veolia, something like that. Our clients are looking for that sustainable circular economy. So they're trying to show we're putting this out and we're doing the best to recover what can be recovered.
Interesting.
I'm sure there's gonna be questions because I've never thought that I'd be sitting here in front of you guys discussing this.
Well, it's new to us as
It's-
well.
Yes.
I think that obviously the main concern is pathogens and
Yep.
exposure. You know, I mean, I'm sure the process is quite specific. I mean, an autoclave sterilizes things.
Mhm.
I think this board and I think this community, I mean, if you look at the agenda today, we have another frequent violator of we have a trash heap in a residential area of Lawrence. Lawrence is 6 square miles, so
Yeah.
when we bring in these heavy industrial, there's grease processing, which has odors related to it. There's metal processing, which has noise and truck traffic and pollution right within a very dense residential area. That has been an issue for many, many years. Whenever there's an industry that wants to come into a 6 square mile town,
Sure.
there's always gonna be some grumbling. Why Lawrence? I mean, is this the path of least resistance? Is it we would love to have light industrial and tech coming to Lawrence, maybe a resumption of the textile industry in some shape or form, but when these heavy industrial processes that have potential harm to the community get presented, Lawrence our immediate reaction is, whoa, why Lawrence? Lawrence,
why us?
6 square miles for 85,000 people crammed into 6 square miles. We have Winfield, which we've been dealing with for years, which is recycling metal,
Yep.
right next to an urban project, and
Sure.
it's but if you can spell out for us,
Yeah.
really the design. I mean, if this is a clean operation, that's in a mill, that doesn't have any byproducts, that has little to no waste, that's not incinerating things, I think we could possibly get our heads around it, wouldn't you say?
I'm not expecting
Did I
an
go to
answer.
college with you?
Yes.
What's that?
I went to
I went,
Mass with him.
I went,
Oh,
that's
that's
why I
good.
went,
That's
like,
fine.
Steve.
Yeah, that's good.
So, this was one of the systems. Yeah. it was-
Also where you wanna locate it, so that's.
Yeah, so the reason I'm looking at Lawrence, and you can pass it around, but this is one system that's more of a steam autoclave. We're moving towards an energy efficient microwaving autoclave, so there'd be no byproduct.
Yeah.
So from a greener perspective, and the reason you asked about kind of Lawrence and Merrimack Valley, I live close to the area, selfishly it'd be convenient for me.
Yeah.
And 2, close to Boston, close to the major medical institutions.
Yeah.
That's kind of the reason there.
Yeah, I mean, I think, the more we learn about the process, the more comfortable we're gonna feel with it.
Sure.
But it definitely needs to be in a light industrial zone, not in a residential area.
And where are you doing it now, sir?
So we are not doing it currently, right now. We're looking for a place that allows this, because no one is doing this. As crazy as this will sound, these large $30 billion device companies have been speaking with me and have not found anyone. There's someone out in Texas that's kind of doing it, but a lot of which you probably are aware of from the hospital, a lot of places will pick up medical waste and transport it, but it's either going to landfill now or it's going to incineration. And they're very few, as you're probably aware, are legally able to incinerate in the state. So they're more of the
Yeah.
middleman, which is driving up the costs, where we would
Sure.
either reprocess.
This can't go to any normal landfill.
So even, I won't name, a large company that picks up most of this stuff, they will autoclave and it's going
What does
landfill.
Stericycle do with their products? They autoclave them.
Autoclave most landfill. Some is going waste to energy now,
I
and
see.
I don't wanna get
Well, you're right,
sued
you're
by
holding,
Stericycle.
you know, we're seeing more
So-
and more single dose pens.
This
For
is,
the GLP-1s, for
Yeah.
insulin,
so this is
it's your
what
main customer right here.
picked up, these would be retrieved, obviously we go through a shredding process, but it shows you the components that are in them, whether all the, we would break it down from plastics, from the PP, PE, HDPE, all the different commodities, and reuse. The initial goal is to do a reuse of, let's say, track stacking, we'd supply them with recycled plastic. Playground equipment.
Employs people.
What we wanna get to would be repurposing this into other medical products that could be used in hospitals. So now people are using at least a percentage of recycled
Yeah,
plastic.
yeah.
How many employees you thinking about?
I mean, initially the startup will be probably 10, but as you're probably aware, this market is extremely large, and I would never say that we're ready for a mass general to start. We've had conversations with them about starting pilot small programs, but it could grow into a very significant company.
What
Yeah, I
about
mean, I
those-
think, if you look at, you know, hospitals are one of your customers, but
Mhm.
physicians, we pay contracts to Stericycle to do
Yeah.
pickups, we have sharps container in every single room.
Yep.
And we have, you know, so, you know, if you multiply all the community-based
Correct.
physicians and have a way to contract with them, you know, that could be another target market for you, for
Yep.
sure.
In our initial clientele will be those ones that are willing to change things, right? No one likes change, but it's those circularist economists that wanna say, you know what, there is a better
Yeah.
way, can we do that?
Well, I mean, I think it's definitely something I'd like to learn more about.
Okay.
Where are you at in the process?
We have signed CDAs with clients.
Okay.
Right now, what we're trying to do is have them predict volume, because the equipment that we would have to purchase is expensive. And I don't wanna buy the equipment, and then you tell me we can't do it in Lawrence,
Yeah.
and then I have to find another place. So
Well, I
we're,
think-
that's kind of where we're at. Now, I will say this equipment, much like autoclaves, they all have a testing validation, so it's all
Of
going above
course,
the
of
270 degrees.
I have two items to consider. One is the noise pollution, like you mentioned. And also, have you explored more of the city ordinance in terms for zoning? So I don't recall that in our city we have a ordinance that allows for waste companies, doesn't matter the background or the field,
Sure.
to come to the city, but it will be zoning who will review with him
Yeah.
and approve or not, and then from there, he can come with the project
Okay.
and present it to us.
So I
Okay.
think it would be good to go to zoning, find a site that you think would be viable, and before you purchase anything, you come back to us with
Okay.
those two things, and we'll have a discussion again about it.
Okay, so zoning first, if they say good, come back, show you more of the detailed process, what we're gonna do with it,
And a
okay.
prospective site.
Perspectives.
I just wanna make sure this would not be close to residential. There's lots of options, I mean, there's millions of square feet of mill space,
Yes.
so, but, yeah, I don't know if there's anything zoned in the city for medical waste processing, but.
Would you classify that in your experience, when I go to zoning, medical waste?
I would just say waste
processing?
processing.
Waste processing?
Yeah,
Yeah.
waste processing.
I mean, just to give you a little background, you know, the Merrimack Valley is been a victim of a lot of we're close to a lot of incinerators. And Lawrence has the highest rates of asthma in the state.
Okay,
And so the particulates, you know, and certainly, you know, it's a long history of mills spewing particulates.
Yeah.
And now incinerators, so you know, if you can assure us that this is not gonna affect, there's no byproducts, there's no venting of no odor, we would be much more open to the idea. But again, Lawrence is very sensitive to
Understood.
industrial processes coming to the city. But there's ways you can make us feel more comfortable with it, for sure.
Understood. Okay.
All right.
Thank you very much.
Yeah, whenever you wanna come back, just reach out to,
They've been great. I've
Yeah.
hounded them for
yeah,
2 months.
they are
so
great, so
I appreciate.
you're welcome to come back,
appreciate it.
they'll put you on the agenda whenever you're ready,
Okay.
okay? Okay, good.
Thank you very much.
Thank
You
you.
got it. Thank you for coming, it's interesting. I'm happy that, somebody's trying to recycle those things.
This, like I said, I never expected to be here.
It's amazing.
But this, it's a huge problem for, in not just the hospitals, home health, and the manufacturers.
No, we generate so
That-
much waste, just
Yeah.
vaccinate, all these pens that I'm
Correct.
giving to people, I mean,
Yeah.
it's sometimes, you know,
Thanks, Steve.
there's single dose
Nice to see you.
pens for so many things now.
Yeah,
Okay,
will be
have a good
strong.
day, have a good
Oh,
evening.
yeah. Thank you, have a good
Thank you
meeting.
for being here.
Okay, lean back just a little bit, because we're gonna do, I just want the camera to catch us, all our mugs.
All our mugs.
All our ugly mugs.
Yeah.
Lean forward. So are we gonna do anything, besides, before we, are we gonna do the fire incident?
Which address do you have on record? Which one?
So we have, let's see, this one is
Enfield Outlet?
15 Medford Street.
Yeah, which one is that?
So that was the fire on 827.
On like scrapyard.
Okay, so what transpired that day?
I'm gonna read on behalf of, Inspector Phillips Davidson. So on the morning of August 27, 2025, the Lawrence Fire Department responded to a fire incident at 15 Medford Street, Lawrence, Mass, where multiple fires were discovered burning within a large pile of mixed scrap material in the facility's yard. Following the incident on August 28, 2025, the Fire Department Fire Prevention Division engaged in the Inspectional Services Department to conduct a joint conduct compliance review. During the inspection, several serious violations of the State Fire Code 527 CMR, Building Code 780 CMR, and Local Ordinance Lawrence Municipal Code 15.04.010 were identified. Based on these findings, the business was ordered to cease operations until full compliance could be demonstrated. Underneath, on the document you have in front of you, are the different violations that were fined and the correction actions that were asked by the different departments: removal, reorganization, and proper storage of the scrap and pallet materials, clearing and maintaining all egresses pathways, ensuring proper maintenance of doors, openings, and protective features, submittal of comprehensive corrective action plan, implementation of a staff training program including emergency preparedness and fire response, housekeeping and site storage management, compliance and identification procedures, and waste oil handling. And I believe last week, both parties went to city council meeting, kinda like gave an update where was the company, and I think they're missing only, bringing kinda like a plan, how they gonna, in the future, respond to an emergency if needed. But everything else, they already relocate all the scrap and metal materials. They've been in compliance with everything else, with, training and certification, just waiting for the report of emergency preparedness.
Does the facilities like this, receive routine inspections?
Not necessarily. So
Yeah.
the reason being because they are, inspected by the fire department when they are requiring a renewal of their licensing. But that's something to consider if this board think is, is important, relevant to the type of work that they do in the community.
I mean, especially given the fact that Winfield,
Mhm.
it sits right next to the Market Basket Plaza, right next to a bunch of restaurants and clubs, right next to,
Two
you know,
housing
housing
projects.
This one has
projects.
pictures.
And so I think that, oh my gosh.
Is it yearly visits, the fire department, is it yearly?
Well, I
Yeah.
can speak on that somewhat. I did, listen to the public hearing that they had in front of the city council the other time, but they do frequent, inspections. They could be yearly. The frequency of them happening lately, that hasn't been, in a while. They should be doing quarterly with the fire department, as well as from the building side, maybe yearly. We don't have the record of when
Well, the
they
last
had
time.
was the
the
last
last
time?
time official. And I think Phil could probably speak on that a little bit more, based on maybe doing 110 inspections, the periodic inspections that could be every year, every 3 years, every 5 years, depending on the type of business that it is.
I would like to see this seen quarterly, with a combination of the, fire department and us. I would love to bridge it up, just to make
And
sure.
the quarterly portion of that would be under the jurisdiction of the fire department. They do quarterly inspections.
No, like, if, for instance, if they do a yearly, I would
Uh-huh.
love us to do 2 or 3, to
Right.
make sure that some
I mean, we could,
agencies.
you could suggest that, request that to the fire department.
Yeah.
I mean, and I think if they need to do anything with this white Chevy Bel Air from the 1950s, I'd certainly be happy to take it.
Yeah. That's been
Yes.
difficult.
Me too. Something to have also in mind is that when they apply for the renewal of their licenses, normally these approvals go through the city council.
Okay.
And so that's probably the disengagement, or the disconnection, perhaps you say, with our department. Maybe if we can ask the city council that whenever they apply for these renewals, that we are also aware of this, so we can go and inspect that, can probably, bring down the amount of, you know,
Yeah,
violations,
yeah, I think
perhaps
that's a,
not necessarily overseen by other.
as, you know, yeah, in conjunction with the fire inspection, there should be an inspection service. Inspection, absolutely.
I also have, some documentation on 322 Lowell Street from Mr. Phil.
And that's,
Mm-hmm.
322 Lowell Street.
I think this is a new.
This is the other one that.
Oh, the only one for now.
Mhm.
I'll read over very quickly. So on the 18th of August 12, 2025, the Lawrence Fire Department responded to a significant fire at 322, 324 Lowell Street.
Oh, yeah, yes.
The fire impacted a total of 6 properties, displacing over 45 residents. Affected properties, were 320 Lowell Street, meaning contracting, 322, 324 Lowell Street, 326 Lowell Street, La Nueva Fogata Restaurant, 328 Lowell Street, 85 Oxford Street. Of the initial finding, 322 Lowell Street and 326 Lowell Street were deemed unsafe and dangerous. The building department convened a board of surveyors and is moving forward with demolition proceedings. 3 properties sustained extensive damage, and several others require safety checks, utility restoration, and temporary relocation of tenants. Since August 12th, within days, residents of 332 Lowell Street were able to safely return to their property. Repairs at 85 Oxford Street, primarily window replacements, are nearing to completion. Residents are expected to return within the next week. Coordination between the building department, health department, fire department, and property owners has allowed phase reoccupancy where feasible. Current status of September 9th, 322 Lowell Street and 326 Lowell Street have been declared total loss. Residents will not be able to return to these properties. 328 Lowell Street remains unsafe with demolition repairs underway. 332 Lowell Street residents are went back to their property. 85 Oxford Street residents expected to come back or return to their property within the next week. And then the summary of what happened, it's at the end. August 12th, fire displaced dozens of residents and caused several structural damages to multiple properties. Through coordinated efforts across the city departments, progress has been made to restore the habilitation of the less damaged buildings. However, 2 properties are confirmed to be total loss.
Gosh.
Did they say the cause?
No, no details on that on this report. Pictures,
I think the fire department's still investigating.
Okay.
I guess from the health department, recommendation and also inspectional services, although it's not really what we do, we go and see the violations, but one good recommendation, probably, if I should say from the nurses, right, is to our tenants to reach out to those insurance companies and actually have the fire insurance. Some of the,
Renter's insurance.
what is it?
The rental
Renter.
The rental insurance, because, at times like this is when we see the importance of having, backup funds to help these families. Although the sanitary code demands that, landlords and property owners, house them temporarily, it's very, unsafe at times when there's no lease involved or anything. Occupants, regardless leases or not, they're supposed to be relocated temporarily, but in that process, it's good to have that money or those funds available, so it's very recommended for our
Encouraging
community.
people to, and renters insurance is quite
Exactly.
inexpensive.
It's cheap, but you know, the Hispanic population, they don't understand that, they don't believe in those things.
Yeah.
You should be responsible for that. You shouldn't be, making responsible the landlord to be taking care of the,
That's-
rental insurance.
That's the law.
It's in the law.
Was this any of these buildings sprinklered? Probably not.
No, there were existing structures,
Did they have occupancy permits?
Some of them,
some of them, not all.
and because they were not more than 3, units, they're
Mhm.
not required for the
Why
sprinklers.
Right.
correct. Okay, alright, let's move on to Methuen Lawrence Shared Services Grant. So I just wanna, there was, were you at the meeting on the 20th?
I was not, I was,
So, I mean, this grant, which Lawrence is still a part of, is exciting. It gives us a lot of incredible opportunities, to make some significant, headway in making our city a safer, more prosperous place. And so I just wanna review some of the details about the shared services grant. So this grant is for $584,000, almost $600,000 a year. The current year has over $500,000 plus, and the next contract is for 3 years instead of a one-time. So, overall, this is a staggering number. We're looking now at over $2 million to be shared between, Lawrence and Methuen. So, I think that what we can glean, I wasn't at the last meeting, I was unable to be present due to a family vacation. However, I do have the notes from the meeting, the minutes, and so there was a lot of progress. Octavian Spanner was present from the mayor's office. There was, representatives from Methuen, and there was discussions regarding the grant administration, requiring monthly meetings and quarterly governing body sessions. There was a conversation about sustainability and expanding our shared services, specifically supporting staff training and inspections. There was also discussion regarding continuing operation at the Community Resource Center at 1 Broadway, open to all with no residency restriction. Communications, there was talk about newsletters, reports, press releases, media. An annual report preparation is underway. There was a suggestion about outreach through broadcasts, radio, social media. There was discussion about performance standards to meet public health service benchmarks such as disease prevention, community education, and training. The program activities which were discussed were infectious disease prevention, namely shared epidemiology outreach, an example being the participation at Lawrence Night Out, and bilingual educational materials. Continued training support for public health nurses and inspectors will be a crucial element of the shared services grant. Staff development, we're going to discuss that collaboration with training hubs, exploring consultant support for food and housing inspection, noting the DPA consultant pay limitations, which I will get to in a minute. So the budget summary for fiscal year 2026, there's a couple of allocated resources for shared staff. One being a coordinator for the shared services grant, two being 2 inspectors, and half-time epidemiologists, which will be shared between the 2 communities. There's also money basically earmarked for a health agent, prorated for 9 months. Consultant services, health education, inspection supplies, membership fees, nursing supplies, software licenses, travel for training fees, admin and agency support. So there were 3 newly hired staff members through the shared services grant. There was the coordinator, Jenny Otero. There was the epidemiologist, Allison, and 2 inspectors were hired through the shared services grant, Vanessa Santillan, who we know well, and Carla Frias, 1 from each community, Lawrence and Methuen. There was talk about reporting and accountability, about delivering reports, dates of training, attendees' names, locations. And there was also a request by Octavian Spanner regarding a newsletter seeking a 2-paragraph summary on the grant and the partnership. There was also discussion about encampment removals and the rail trail project. Discussion future plans for the rail trail project and removal of the encampments. A previous meeting was held with the Mayor's Health Task Force to address this, as well as the Lawrence Police Chief to begin the encampment relocation process. There was discussion about the consultant budget concerns, ongoing challenging, recruiting qualified consultants due to state pay caps. And there was also discussion about mosquito and tick-borne illness. We are in West Nile virus season. There have been mosquitoes identified in surrounding communities that are carrying West Nile virus. We have not had any deaths this year in Massachusetts. So there was election of officers. Tavian Spanner from the city of Lawrence is going to be the co-chair, and Jordan Normandia from Methuen will be the chair of the shared services grant. And the next meeting is going to be December 10th. So, the grant is quite large and can really make a difference in filling the gaps and helping us train and bring in new resources to the city of Lawrence. But there are restrictions that we all should be aware of in regarding what the budgets are restricted to do, and how the expense is shared. So I have the allowable expenses, if anybody ever wants to look at it, and we have suggestions, like for instance, we had Sergio Espinosa come and discuss with our restaurant roundtable about plan reviews and helping restaurants access grants to upgrade their kitchens, and I think earmarking him as a consultant through this grant might be a great idea for both Methuen and Lawrence, because he's incredibly knowledgeable. He actually knows a lot of the restaurateurs in the city, and I think he brings a lot to the table. But the grant is, again, bringing almost close to $2.5 million to the share, both Lawrence and Methuen. And it can also help with contract tracing. So it's vast, and it's something, very exciting. And so, hopefully we can continue to put this on the agenda. We can certainly invite Octavian to come, as he now is the co-chair of the Shared Services Grant, to talk about his ideas, about what he sees as a good use of these funds to bring our city into the 2026 new year with a rigorous training program and support. And that's what I have to say about the shared services. Anything else you want to add?
You summarized everything very well.
Could we invite him for the next meeting?
Yeah, absolutely, I'll reach out to him, it'll be anytime. So, any comments, questions, concerns?
I just have a question,
Yeah.
do we have a date for the next meeting?
Oh, yeah, next meeting, okay. We're gonna set the next meeting for, let's see, October 14th, how does that sound? Middle of October?
Sounds good to me.
Okay, so is that good for you?
Good.
Tuesday as always.
Is it the second Tuesday?
Second Tuesday, yep. And, is that a council day?
I'm not too
Well,
sure.
we'll try to make it be done by 7.
Mm-hmm.
And so, do I have a motion to adjourn?
Can I have a motion, can I make a motion to adjourn?
Second? Okay. Motion is accepted, all in favor? Aye.
Aye.
Have a good evening.
Thank you.
I want the gavel.